Run, river, run, run through the hills. Run, river, run to the sea. Run, river, run to your place beneath the sun. Run, river, run over me.
Hi, this is Jan Lewis. Welcome to be my guest. We have a guest today from Westboro, and she is a massage therapist, but she also is going to share with us about her surviving breast cancer. Very important. She had it in her family, and she's going to share with us. It's amazing. Her name is Paula Kirk. Welcome, Paula.
Hello.
And I read about you, about the upcoming October 10th event, the anniversary.
It's actually the 16th, October 16th.
October 16th.
Yeah.
And where will that be?
So that's at Westboro Massage. That is at 18 Lyman Street in Westboro,
Sure.
and that is in the, I want to say it's the Westboro Shopping Plaza. It's the same plaza where there is a Staples and a Home Goods. There's Tatnock Bookseller and DCU, and we are upstairs.
Paula, let's start with, you were taking your massage courses before you got hit up with, what happened? Tell us the timeline that happened.
So I was in massage school from like 1997 to 1999. I graduated in 1999. I went to a school up in New Hampshire called Dove Star.
Where's that located?
So it was located in Hooksett, New Hampshire. It's actually since closed up near Manchester.
I went to school in Plymouth, so yeah.
So at that time, I was working full time as like a customer service rep in an industrial company. So I was working full time and going to school pretty much on the weekends. And they had a program that was very flexible, so that I could just fit it in around my job. At my own pace,
yeah.
so you know that was a good thing. So I got my license as a massage therapist in 1999, and then it was not until 2009 that I had an early stage breast cancer diagnosis.
Stage 1?
It was actually stage 0, but they told me, you know, it was cancer and that I should get a lumpectomy, which I did. And then I was also on a drug called tamoxifen.
I've heard of it, yeah.
Yeah, for 5 years, which is an estrogen suppressor. So that's, so any breast cancer that is like fed by estrogen in the body, that's why they put you on it.
And it basically will kill it, right?
It puts you in an early menopause, kind of, mm-hmm. so that the cancer cells, aren't activated.
Mm-hmm. Given the choice between
by the estrogen,
the cancer and the menopause, there's no choice, right? It's got to be the other.
That's my understanding of it, and I'm certainly not an expert on it.
And so, how long did you go through chemo at all?
No, it was just, I had a lumpectomy, and then I was on this drug, tamoxifen, for 5 years.
Wow,
5 years.
5 years.
Yeah.
And did they give you that 5 year? My husband had colon cancer. They caught it early. Basically, he's doing great. But I think they kind of tell him, 5 years, if you can keep this up for 5 years, you're out of the woods. Did they tell you that?
Pretty much, but I actually still see an oncologist once a year, and that was now 12 years ago.
Wow.
So at first they had me going, for mammograms every 6 months, and then eventually down to once a year, and I still see an oncologist once a year. So basically they just want to kind of keep an eye on you, because actually the type of breast cancer that I had, very early stage, DCIS, which means ductile carcinoma in situ, however you say it.
Yeah,
but
situ, yeah.
In situ, in situ. Basically, it means that it's not likely to spread, but they just want to be careful, so that's why they do a lumpectomy. And some people have to have radiation, some people have to have other treatments, but I only had to have just that drug and the lumpectomy.
Did you have that thing? I think it's called it's if you have a fibrous tissue, a lot of fiber in your, what is it called? I think that's it. It's ultrasound, a breast ultrasound?
Yep, I had to have
What's that like?
I had to have an MRI as well. Breast ultrasound is really not terrible. It's just, it's just that gooey gel that they put on you,
Yeah.
and they use an instrument to kind of check everything. So that's really not bad. It's
So
not,
it's probably a lot better than the Smashmogram.
yes,
I hate that thing.
It's much nicer than a mammogram. Yeah.
Yeah, I'm one of those people who's very verbal, very vocal, and I like, hurry up.
Yeah.
They'd say, hold your breath. You're like, I don't feel like it. So,
Yeah, it's not. That's
when
not
did you start working at the Westboro Massage?
in 2016. So I've been there about 5 years. Yeah. Prior to that, I worked at a day spa in Westboro for like 11 years. It was called Starseed Day Spa, and then when that closed, then I moved over to Westboro Massage, and I like it. It's a very nice place to work.
It's right. If you like Tap Nook, I talk about it. Tap Nook Bookseller, I found out you go in right beside it is the DCU, right?
Yeah.
Go in that door, and then there's a special,
It's in between the two doors of the DCU.
I never even recognized there was a door.
Because there's a second floor to that building. It's an office building. It's actually a really old building. But upstairs from there, that's where there's a Pilates studio, there's a dentist, I think there's a lawyer. So there's...
You got it all up there.
It's an office building, yeah.
That's good. Now, so when are you working there? What hours and days?
I'm there typically 4 days a week. I'm there Monday and Thursday afternoon and evening. I'm there Saturday during the day. I'm there like every other Friday, and I work the occasional Sunday. So, but I'm typically there 4 days.
To me, when I've gone to a massage therapist, I got to admire these people. Where do you get your strength? One person, where do you get, what's the secret? I don't think I could do it for more than one patient.
Well, you have to, a lot of it is the body weight that you use. It's, you have to lean your body into it. That's a lot of it. And plus, I do now, finally, I started going back to the gym for strength training, because I really do need it at my age. I'm 58, so massage therapy isn't necessarily an older person's type of career. So
that's okay,
because it's pretty hard, and it's hard on the body. So I have to keep
you enjoy it though,
my
right?
strength up. Oh, for sure, for sure. But I have to strength train and stretch and keep myself in good shape.
Paula, how can they get a hold of you?
Okay, well, Westboro Massage. It's westboromassage.com. You can also find us on Facebook, Westboro Massage. That's mostly it, I guess, right? That you can call them. It's 508-244-0444. I have that memorized. You can find me on Facebook, too. I'm on Facebook.
Paula Kirk. We're talking with Paula.
That's me.
From Westboro, and she is a breast cancer survivor, and she works as a massage therapist at Westboro Massage, and I think that's fantastic. The things, she gave me the brochure, the things that they cover, Swedish or relaxation, deep tissue. I had deep tissue one time, and I nearly went through the roof. That hurt. Now, how do they get around that from hurting? It really hurts.
Well, what I do really is more what we call an integrated body work, which basically it means you're just mixing a lot of different styles. But even deep tissue, if it's done gradually, it shouldn't be painful. It's kind of working through each layer of the muscles until you get to the deeper layers. If you're lucky, you can do it without hurting anybody or without being hurt. Depends on the person.
I got a surprise. But I like Swedish massage because it's easier. I really do. I don't know how they get the strength for a whole hour, because they put their soul into it. From what I've experienced. Do you get tired at all from it?
Oh, of course, yeah, for sure.
You have to space your clients.
Yeah. I just have to pace myself. I can do 4 or 5 in a day. That's it. But I only work 4 days a week, so so I have a couple days to rest up.
That's good. Now,
not like when I was in my 30s when I started. So.
Hot stone. Now you brought some things with you. Show us what you got there.
So I just have. There are a couple of different shapes of stones. These are actually called core stones. So this is a brand name, and if you look on the Westboro Massage website, core stone is an actual brand name, but it has to do with the fact that they're made of soapstone, and core, I believe, refers to the shape. So it's like a core of stone. They're not a naturally occurring stone like you would find in a river. And then I have, this is also a core stone, but it's a different shape, so kind of hard to show you without it being on a person's body, but it has sort of a little bevel here, and what I typically use those for is to kind of like dig under a person's shoulder blade. So they're shaped to be a little bit of a more precise tool versus just like a regular
What does
river
the other
stone.
one do? The first one you showed us.
Here, this basically, I would typically go up and down somebody's spinal muscles with this.
Okay.
You know, or maybe on their legs, back of their legs.
Yeah.
You know, there's different shapes, sizes. They hold a lot of heat.
Yeah.
And then the other thing I have here is just some cups. So I'll show you.
I've heard about this.
So these are they're a silicone. They're soft. You can vary how much suction it is, and it looks very weird, but I'll show you. It actually kind of pulls pulls the top layer of tissue up into it, and what it does is it kind of separates it from the layer of muscle beneath it, so you can get muscles to loosen up a little bit faster and without quite as much pressure, so it shouldn't be painful. So sometimes I often use those on people's shoulders, like the traps, upper shoulders, because a lot of people have what they would consider be not, just a spot that's really tight there. That's one place we use them. It's about all I got for show and tell, but
that it's funny.
Yeah.
Those I can't lay flat down because I have vestibular vertigo on one side. That was because of a major surgery I'd had years ago.
Yeah.
But I can get on my stomach, but that donut thing you put your head in, it's usually just too low, and they can't seem to bring it up from what I remember. High enough, it's tough.
You can put your head in a pillow. We can put people on their side. Like I do prenatal massage, so I work with a lot of pregnant women, and typically for them, they're never face down. They lie on their side with a pillow, a pillow underneath their neck, and then one to kind of like lean their leg over, like a like a body pillow. So for people that
use that.
so for people that have a hard time going face down, that's typically what I do. Do as much as possible with the person face up, and then have them go on their side.
We're talking with Paula Kirk, and she is a breast cancer survivor, and she's also a massage therapist at Westboro Massage. Again, Paula, how can they reach you?
So Westboro Massage, that's it's in the plaza where the Staples is, westboromassage.com. Westboro spelled out, O-U-G-H, and they've got a website, there's a Facebook page, there's an Instagram page. And you can call on the phone.
And I think I think online, if you're a first-time customer, it's $15.
Right, you get $15 off the first time you come for anything that's an hour or longer. So.
Oh, that is so awesome.
Yeah.
Okay, I got a major question here. What happens? I'm always so afraid. I remember having in the past being afraid to fall asleep. What happens? I mean, do you mind that? Is that an insult to the...
No, it's good. It just means that you were able to relax. And if you fall asleep and it's time for you to turn over, we will just gently nudge you and say, I need you to turn over. I mean, most people don't fall all the way to sleep. They kind of, nod off a little bit, and then they wake up. So.
Okay, so it's not insulting your therapist.
Oh, no, it's a compliment. Yeah.
Okay, because I always thought, I guess I have to say something once in a while. No?
No.
Okay.
It just means you needed to sleep and you were able to relax. Some people have a very hard time relaxing, and if they're able to relax, it means that we did a good job.
What is the hot stone one?
So the hot stone is for for one thing, it's relaxing, but also the heat. It's like having, when you would use a heating pad or you would take a hot bath, hot shower, it will just help the muscles to loosen up, to soften up, to enable, us to get in deeper into the muscle to get it to release better. I use those little stones that I showed you. I use those a lot on people's necks and shoulders, so around their shoulders, where a lot of people have a tight spot. It's kind of like right
That's
here,
me, right in
between
here,
the neck and the top of the shoulder.
Yeah.
So I'm sort of like scooping with that stone to try to get it to calm down a little bit.
But when I think hot, I think a lot of people think, well, would it burn? But it doesn't.
No, it doesn't. Yeah, I mean it's warm. It's not hot like
It's not going to
It's not
boil
hot
you.
like an oven, but it's warm. Yeah.
Over there, do you have? I think it's great when they have. It's almost like a little flute music in the background. Do they do that?
We have all kinds of music. We actually use Pandora, so there's like 6 stations to choose from. So it's whatever people want. Anything from piano to flute to guitar. It's just something that's relaxing.
Yeah, I remember when years ago, I had my first massage. She had this wonderful, I don't know if it's an American Indian flutist, but it was just, you're in a new world. I mean,
yeah.
I just loved it.
That's a lot of what I like to play because it's not tunes that you know. So I actually have a few friends that are musicians, and that like a tune that kind of distracts you from being able to relax for some people.
Yeah.
So
it does for me.
So sort of an unfamiliar tune, you can just sort of zonk right out. And
exactly. I think it's great. Well, I know a couple times in the past, years ago, I'd go in and I found out that the ticky-tick-tock on the clock, tick, I had to ask, could you please take that down? I'm one of those people that I can't have a massage if I'm hearing that.
Oh, okay.
I can't tune it out.
I don't think there's a noisy clock in the room I work in. I mean, most of us have some type of a white noise machine that kind of drowns things out a little bit. I have one that has, ocean sounds, babbling brook, what have you. So if you need something like that, usually
I saw a picture
you can do
online in one of the rooms at Westboro Massage Therapy. Boy, does that look relaxing. Do you decorate it? Does each massage therapist decorate her room in a certain way?
No, there actually are a couple of people there that rent a space, but those of us that don't, we just work there. It's kind of a group effort to get some nice art in there, and
As a breast cancer survivor, do you highly recommend this for somebody going through the treatments, or is it too rough on them?
Well, I'm not an oncology massage therapist. That is something that you have to take some special training for that, which right now, I actually did look into it, and right now the sort of most well-known oncology massage teacher in this area is not doing any live classes because of COVID. But depending on what stage people are at in a cancer treatment, massage can really help. If they're right in the middle of chemo, it might be a bit too much, but that's the kind of thing they kind of have to talk to their doctor about. I've certainly worked with people that were like between, chemo rounds, or, well past treatment, or hadn't started treatment. A lot of the women that I've worked with have had, say they've had lymph nodes removed because of breast cancer, or they have mastectomies, and it's basically you just kind of need to know how to work around those areas, and just to not to aggravate anything.
Yeah.
But if somebody is in active treatment for any kind of cancer, basically we just need to ask a lot of questions. And a lot of times I will refer them to somebody that I know is trained specifically in massage for people with cancer.
Do you require people to wear a mask in there?
Right now we don't, because it's not mandated. I personally, I do wear a mask most of the time, just because the CDC recommends it, and I feel like it's a good idea. Even if I just had the sniffles from a cold or something like that, I don't want to pass it to anybody. But right now, it's not mandated. Most of the people that come in are vaccinated. So basically, right now, that's up to them. It's optional.
Should they present their card to show?
No, we don't ask. Yeah, we don't ask that. Most people will just tell you.
Yeah.
And if there's any concern, we say that if somebody prefers that we, as therapists, wear a mask, we're happy to do it. We have them to give out. We always have them ready to go.
Yeah, I can't picture myself getting a massage and trying to breathe.
Right. It is hard. It's mostly the face down. It's kind of hard to breathe. Face up, it's not too bad.
Yeah.
But that was one of the big challenges we went through, with COVID. Businesses like ours, which are deemed non-essential businesses, we were closed from like March to the end of June of 2020. And then when we were finally able to open again, there were a lot of restrictions on us. We had to wear gloves, we had to wear like an apron, just sanitizing protocols and all that kind of stuff. And we do all those things. We were already cleaning a lot before COVID came, and now things are a little bit more relaxed. But we're still just very careful. We have HEPA filters in the rooms to keep good airflow and killing any germs or even any allergens to kind of get those out of the air.
When you were going through breast cancer recovery, was there anything in particular that helped you along?
Well, friends and family certainly were a big help. Like I said, and I'd had, it was my niece who had breast cancer actually a couple of years before me, and what she had was actually pretty severe. And what I had was...
Was she the very young one?
Yeah, age 23. So she had all the pretty much all the treatments you could have.
Yeah.
And she's doing very well now. But and seeing what she went through and the great support that she got, what I went through was very it was doable. I wouldn't say it was fun, but it was okay.
I could see getting a massage from my own point of view if I went through something like that. Even the things I've been through, the surgeries, anything to relax me would be fantastic. I mean, really. I think a lot of people don't realize that they're carrying around the worry, the anxiety inside.
Oh, for sure. Yeah.
You must see a lot of people coming in that have that. From COVID,
absolutely.
too.
Yeah. Yeah, and when people recently, started getting vaccinated again, whatever that was, March, April, May, a lot of people started coming in for massage because they finally felt okay, and they felt safe getting massage because they were vaccinated. And, people do ask us sometimes, who's vaccinated, who's not vaccinated. Basically, I don't know that we really have the legal right to ask people if they're vaccinated or not, but I usually just tell people I'm vaccinated and don't worry about it, and typically people will tell us as well.
What is aroma massage? Sounds
like aromatherapy. Basically just using essential oils, typically because the smell will help relax you. There are other people that make kind of more of a science of it. For me, basically, I just give people a few smells to try and see what they like. Some like citrus smells are supposed to be a little bit more uplifting, and others like lavender are supposed to be a little bit more relaxing. Peppermint and the mints are more sort of like refreshing, and there are some that have like pain relief aspects, like peppermint and wintergreen are in a lot of those, like Tiger Balm, those types of things have a lot of those.
Do you have vanilla?
Not typically.
Because I have a friend who just had surgery on Monday. I'm thinking she might like that. The citrus, I would love that. That is something that would be very relaxing. Okay, so we covered that. Cranial sacral therapy, what is that?
So cranial sacral therapy, it's actually not... It's not exactly a massage, although a lot of massage therapists do it. It's a type of, you would call it body work. It's really gentle, and it's sort of a cousin to chiropractic and osteopathy, because it was actually developed by an osteopath, which is basically a bone doctor. They work with the skeletal system, and a lot of what it's focused on, cranium, the head, sacrum, your low back. So what it has to do with is sort of gently aligning the cranial bones, the neck, the spine, the hips. And what it has to do with is circulating the cerebrospinal fluid, which for people that say have had head injuries, concussions, that type of thing, sometimes that is disrupted. Like I had one lady I worked on a few times she actually had craniotomies. She had tumors removed in her brain, and she said she could feel how that that was disrupted, and that the craniosacral seemed to just make it feel more normal. It's kind of hard to explain.
What a trauma that is.
Yeah, kind of hard to explain. But I mean, it also, it's just very relaxing. It's just a gentle way to move, like the head and neck, especially for people that maybe they've had a neck trauma, they really can't tolerate anything very vigorous, but they just want to relax, or people that have sinus problems. Sometimes it can help with that because, the ears, the sinuses.
Is there a sinus massage that you do?
It's part of craniosacral.
So you do actually do that?
Yeah, I mean, there are moves you can do that will activate some of the sinus points. The ears and the jaw are connected.
How about TMJ? Does it help that?
It can help with that.
Big time.
Yeah.
I have it. I was seeing my ENT over at UMass the other day, and I said, I found out a way to stop ringing. He says, what? And I said, open your mouth. You'll hear it, and then it dies down and goes away. He says, that tells me a lot of your ear problems are TMJ. I said, I know, I clench and I click.
Yeah.
It's so much of the people hold their stress, right? In different places.
For sure.
Yeah. We've got about 3 minutes left. We've been talking with Paula Kirk, and she is a breast cancer survivor, and she is a massage therapist at Westboro Massage Therapy. If you go to, Lyman Street, and you know where Chattanooga Bookseller is, it's a door between that and the DCU, right? You just go in that door. Do you go upstairs?
Yeah, it's up a flight of stairs. There's also an elevator.
Okay, so that's good to know.
Yeah, and there's actually a big sign on the building, but it's like you have to look up. I have to.
Is it next to the dentist? I've seen it.
I think it might be. It's on the corner of the building, and there's also a sandwich board, like one of those sidewalk signs, typically, that you can see out there. It's basically right next to the Chattanooga Bookseller.
And how do you get a hold? They hold you again?
So again, you can go online, westboromassage.com, and there's a Facebook page, there's an Instagram page. So those are pretty easy to find.
Are children welcome? I just wanted to squash that. Is it?
Yes, but they have to have parental supervision. Typically, we don't see children younger than, say, 10 or 12, and most of the time when kids that young come in, it's because they've been playing sports, or they've got, issues like that. We do see some teenagers, but basically they have to have parental supervision. Either the parent is right in the room with them, or basically they give permission, and then maybe they sit out in the lobby.
I just got over, part of it, a plantar fasciitis under the heel. It's a horrible pain, and it took since June to recently to get rid of that thing in PT.
Oh, yes.
No, I tripped the other day. There was a mouse in the kitchen. I freaked out, and I fell right on the same foot. And now it's like up higher underneath, more on the arch area. Is this ever going to end? Do you treat anything like that with massage?
Yeah, we can. Yeah. Again, we just need to have a lot of information and see what you're doing, and a massage can treat a lot of injuries and help with injury recovery.
Thanks for being with us, Paula. Thank you so much.
Thank you.
We'll see you next time and be my guest.
Riding on a shooting star, heading out toward a dream. Tomorrow's even closer than it seems.